Join us as we deep dive into the world of physical therapy with Dr. Julia, a highly skilled and experienced practitioner who is passionate about helping patients of all ages overcome joint pain, improve mobility, and enhance their overall well-being. Welcome to Happiness on Tap podcast, where guests dive deep into the vulnerable experiences that contribute to their happiness. I'm Leanne Herron, certified life and health coach, owner of Finding Resilience with Leanne, and host and creator of this podcast. This episode is part of our health and wellness series. Thank you for joining us for Unlocking the Power of Movement with Dr. Julia Nowinski. Hello, Julia. Thank you for joining me. How are you today?
Hi, I'm good, thanks. Thank you so much for having me. I'm really honored to be here.
Oh, thank you. Julia earned her Doctor of Physical Therapy degree from the University of Melbourne in Australia in 2016. She also holds a Bachelor's of Kinesiology from the University of British Columbia in Canada. She relocated from Chicago to Albuquerque when her husband joined the Air Force this year. Julia recently opened her physical therapy office, Ascension Physio, is that correct?
Mm-hmm.
Here in Albuquerque. Experienced in the functional manual therapy, Julia's skill set allows her to excel in treating the whole body and patients of all ages who may suffer from joint pain, including TMJ, foot and ankle issues, vestibular dysfunction, post-op recovery, and complex chronic pain. She is also a women's health therapist, experienced in pelvic floor rehabilitation, and can help women with a variety of pelvic health issues, as well as pre- and postpartum care. Julia is also, and I'm going to mess this up, Stroth Scoliosis Physical Therapy C1 certified to treat both adolescents and adults with scoliosis. Her comprehensive and diverse education and training allows her to provide a wide range of treatment approaches to single and S-curve scoliosis, I'm going to mess that one up too. Please throw that word in for me, Julia.
It's the Scheuermann's hyperkyphosis, otherwise known layman's terms sometimes as the dowager's hump.
Thank you. And other spinal deformities that integrate Stroth, specialized in functional manual therapy and neuro-based evaluations and treatments. So tell us, Julia, just a little bit about what you do and how can people benefit from your services?
Thank you for that introduction. So I have this kind of vast and random array of specializations that came about for different reasons. But because of that, I feel like I can definitely better treat people as a whole. I've had people come in and found that it's actually an abdominal scar tissue issue that's causing issues down in the foot. So I'm definitely not, isolating into the area of focus that people come in with. I definitely start there, but I'm always, looking to see if there's a root issue somewhere else in the body that maybe they didn't consider, or maybe that's less apparent than the primary symptom that they come to me with.
And that's wonderful. I think a lot of people are focused or hyper-focused even on one part of the body that may be bothering them. And, it's nice to have somebody that'll take that time to really go to the root cause, or at least try to, instead of, like regular medicine kind of pushing people out pretty quick, like, okay, here, go to this specialist or that specialist, but not really taking the time to get to the root cause. So I appreciate that you do that with your patients.
Mm-hmm.
Happiness on Tap's mission is to provide value to our listeners by providing tips and tools to help people realize that they are not alone, while providing education and information to help them improve their daily health and life, cope better with life's challenges, reduce their stress, and become the best, most authentic version of themselves. Julia and her husband, as I said, recently moved to Albuquerque when her husband joined the Air Force. And she found one of my Finding Resilience with Leanne Thriving Women's Circle weekly events on all events, purchased a ticket, and showed up. And so it was so exciting. Us, turkeys from Albuquerque, some of us other ladies have lived here our whole lives, really got excited and were able to share with Julia and another recent transplant to our ladies group all the beautiful things and wonderful things there are to do in Albuquerque and in our state. And then Julia was so kind and invited us the next day to attend a bladder health workshop, which we did. And Julia has a lovely and inviting office and treatment space.
Thank you.
Can you share with us your journey and what inspired you to become a physical therapist?
Yes. Also, before I forget, I just want to say I got more than my money's worth going to that women's circle and ended up here, and I'm so thankful. But yeah, my background to becoming a physical therapist in high school, I realized I really loved anatomy and physiology, biology, all that realm of science. So the obvious thought was, oh, well, then I'll become a doctor. I didn't even know, I'd never actually done physical therapy myself. I didn't even really know it existed. So I thought, doctor, that's the healthcare thing that everyone knows about. So I shadowed a few doctors. I shadowed a cardiologist and a pediatrician. And the cardiologist was very interesting, but that's also a lot of schooling. And also just with both of the doctors, the appointments were very short. And the way that you're helping people is either you're writing a prescription or you're sending them to someone else. The cardiologist would do some heart procedures, but again, that's a ton more schooling to get to that point, even though that was something I might be interested in. So when I got to university, I decided to take what was called human kinetics when I first started the degree, and halfway through we voted to change the name to kinesiology. But it's that focus on the human body, movement mechanics, physiology, anatomy, all the stuff that I love. So I went into that field, and the anatomy and physiology professor had gone on sabbatical the semester I was taking it, and they brought in a physical therapist to teach that semester. And when she started talking about the stories from the patients she's treated, the cases she's seen, and what she'd done to help them, I was like, that is what I want to do. She totally inspired me to become a physical therapist. So the closest thing I could do in undergrad was to become an athletic trainer, which I did. I worked with the men's rugby team and the women's hockey team, which was closest to physical therapy. Absolutely loved it. So decided to pursue that in postgrad.
Wow, that is a great story. Yeah, that's a great story. I really like how you got to have that opportunity to have another teacher kind of step in and give you a different perspective. Because sometimes, and it's part of why I love doing this, is hearing other people's stories is what can influence us, empower us, motivate us. So thank you. What are some common misconceptions about joint pain, and how do you treat it or approach it holistically?
All right, so I've kind of revealed myself as a physiology nerd. So we're going to get into the literature a little bit, but I'm going to summarize for everyone. So pain is such an interesting research topic. It's still ongoing. We still don't know everything there is to know about pain. But since even 1986, Wall and McCannon kind of published that pain does not originate from the tissues. So, when people say, I'm a millennial, I love Harry Potter. I love the Harry Potter quote from Dumbledore that just because it's happening in your head doesn't mean it's not real. So the pain is happening in your head, but it is 100% real. It's 100% a human experience to experience pain, but it's not directly coming from the tissues. So Mosley, famous Australian pain scientist, absolutely love him, hilarious man. He published in 2007 that pain is actually a perceptual experience it's your body telling you need to protect the tissue. And there's a variety of reasons that might come about, that your body feels the need that you should be protecting this particular area of your body from harm. But it's not actually pain's not a reliable indicator of the state of tissue. So many people might have experienced like, oh, my knee hurts. I went to get the scan and nothing's wrong. They told me age-related changes. And I just want everyone to know age-related means you're older than 25. So after 25, that's when you start accumulating those, age-related degenerative changes. It sounds really much scarier than it is. And really all it means is that you're older than 25. And so people or even they get their back scanned and there's no herniation, there's no fracture, they're like, how can I be in so much pain? And my scan came back clean. Well, this is why, because something has happened. There's a variety of things, but your body's telling you this area needs to be protected. And that's what that pain is trying to tell you. So with joint pain, the problem then becomes your body's like, oh, protect this. So then you stop moving and you're like, must protect, baby it. But short term, an acute injury, that can be helpful. But when it becomes chronic, that's actually no longer a helpful reaction. And we'll get into how actually movement can be the best medicine to break that pain cycle.
Oh, thank you. I kind of have a question on that just from my perspective and things that I'm learning in my healing journey, in my mental health healing journey, and my physical health healing journey, is how the body hangs on to trauma.
Mm-hmm.
And, then it turns into like a physical ailment if you're not addressing the trauma, the mental side of it. It's been interesting to learn. What is your take on the body holding on to pain from trauma? Maybe not
So
physical.
my take is that of the brilliant people like Mosley. So there's a talk that Mosley did. Actually, you can find it on YouTube potentially, but where he indicated different people to stand up at different times. Like if your birthday's in this month, stand up when I point over here. If you like this kind of coffee, stand up when I point this way, and all these things. So really what he was illustrating were neuro tags. So pain is not initiated by one single stimulus input. So eventually he got to the point where he would say like, oh, if your birthday's this month, stand up. But eventually he just started pointing and people would kind of stand up without him giving the full signal that he had previously given for them to stand up, because they kind of started wiring together. So a lot of people experience pain kind of on the anniversary of a really traumatic incident because you're getting enough of those neuro tags lighting up. Like it's the day rolling around, or if the weather was the same as the day of the injury. There's also the example he gave of a man who worked in a big bakery, had a kind of industrial accident, and just the smell of bread would trigger his pain. So if you get enough of those environmental neurotags firing, even without all of them, even without your tissue even being affected, you can experience pain. So that's where the trauma comes in, is it's that context that the pain is in, that it's kind of illuminating.
Yeah, and that absolutely makes sense. Is that like, how do you treat something like that?
So it's all about kind of, breaking those connections, and kind of the mildest version of exposure therapy, really. So I always say there's a big difference between pain threshold and pain tolerance. So in our society, a lot of people are very proud of their very high pain tolerance, which actually isn't that protective. And then people come into the clinic and they'll be like, it's not that bad. I'm just a baby. Maybe I shouldn't even be here. My pain's not that bad. And they're really ashamed of their low pain tolerance. But actually, it's way better to have low pain tolerance, because then you take care of the problems in your body instead of powering through until they become chronic and much harder to deal with. But on the other side of pain tolerance is pain threshold. So how much of an input of a stimulus, the smell of bread, the whatever, stepping on something, how much of a stimulus does it take to trigger that pain response in your brain? So the more you kind of blow past that threshold, you keep pushing it down until it takes only the tiniest thing for you to experience pain. How you relate to that with your pain tolerance is totally different, but to even be experiencing that at all, that threshold's gone down. So what you want to do is always be staying just below that threshold, so you're nudging it upwards until you can do all this stuff without triggering that pain response. And everyone's very individual as to what we're going to slowly kind of work on nudging that threshold up with.
That was a great explanation. Thank you so much.
Thanks.
What advice do you have for individuals who are experiencing chronic pain and have tried various treatments without success?
So the pain cycle is you experience pain, you stop moving, you get joint stiffness, and then it contributes to more pain. And then you're stuck in that loop of stiffness, pain, you stop moving. So, classical medicine and everything, they're targeting just joint pain in that cycle. They're trying to X out the pain. They're giving you drugs so that you don't feel the pain, and then hope that, the rest of the cycle improves itself. For what I do, I actually prefer to tackle two other areas of the pain cycle and hope that actually improves the joint pain. So I focus more on the stiffness and the lack of movement, because getting those two things going, you get the movement going, that in itself will improve the joint pain. But that's also where manual therapy can come in. It's one of my tools to help with the joint pain in the moment, so that then we can have a better chance at tackling the stiffness, tackling the lack of movement, and just totally break open that pain cycle. So there's none of those pieces left to be cycling in. But so just some more nerdy research for you. So in 2018, Nice and colleagues, they proved that exercise, so everyone knows like movement is medicine and helps with the stiffness, but the other side of it is that exercise can improve your sleep. And sleep has 100% been proven. Lack of sleep will increase your pain experience. So lack of sleep will lower your pain threshold. You'll be more likely to experience a pain response throughout the day. So exercise, not only does it give you that movement benefit, help with stiffness, but it will help your sleep as well, which is so crucial. Actually, not just lack of sleep, but any kind of mental distress will heighten your pain experience. So I actually participated in a study in undergrad to get extra credit for my psychology class. And all they had us do is they had us stick our hand in an ice bucket, timed how long we would leave it there. And then they had us watch a video that was like a lot of words and static kind of flashing at you on the screen. It was meant to be kind of like mentally distressing to have this like strobing. And I think they were kind of negative words that they were flashing across the screen. And then they had timed your hand in the bucket again after having watched that. And looked at like, what is the decrease of time that you're willing to keep your hand in there the second time around?
Interesting.
And it's significantly less. Not just like after you said, but it was significantly less. So any kind of mental distress for a variety of reasons, that will also decrease your pain threshold. You'll be more likely to experience pain with less input.
So do you work with a lot of like pain management doctors? It kind of in their realm. And I ask this because my ex-husband ended up disabled from a back injury. It took us 8 years to get Social Security disability. But in that time, I mean, from the very beginning, it was like, okay, we'll give you acupuncture and chiropractic and massage and opioids. And then once he maxed out as far as the number of treatments he could get from massage, chiropractic, anything else, then it was just the opioids. And, they just kept increasing. And then we'd have to keep adding medications as he was having side effects from other medications. But hearing you explain the pain cycle to me was very helpful, because nobody did. I was always like, because I wanted him off the opioids and would fight for other options, then I was no longer allowed to attend visits with him.
Oh, wow.
Because, I was then considered hostile. But it was because I was fighting for my husband, who was becoming addicted to these opioids. And he was, he would stay on the couch all day long, not moving, not exercising, popping handfuls after handfuls of medications. high levels of anti-inflammatories, and everything. 8 years. He'd been on these things
Wow.
long term, and they were having all these effects. Um, but I
But
don't
none of them
remember.
solving his problem.
No, not at all. Not at all. But I
Mhm.
don't remember anyone ever explaining the pain cycle so that those of us who weren't experiencing the pain could understand the pain.
Mhm.
Because he would always kind of say, well, nobody understands how much I hurt. And I think now, after listening to you, that that was probably fairly accurate.
Mhm.
But at the same time, he would go to a doctor or one of his pain management appointments and they'd say, how are you doing? Oh, I'm fine. How is your pain level?
Mhm.
Oh, it's a 1 or 2. Well, that's because at that moment he was already maxed out on his meds. He wasn't
Yeah.
feeling as much pain. He had gotten up off the couch, had went to his appointment, was moving a little bit, had showered, all those things.
Mhm.
So his pain was less at that time.
Mhm.
Um, but I think it's helpful. I appreciate you explaining it the way that you did. Um, mm, Thank you.
Yeah, the other piece I'll say with that is just that, I mean, people can only, or clinicians can only offer you what they're trained in. You go to a surgeon, they're going to want to cut you open because that's what they do. That's all they can
Yep.
offer you, really. You go to a doctor, they can offer you a referral or they can offer you medication. That's what they have in their arsenal for physical therapy. And this is why I picked physical therapy. I have so many more modalities at my disposal, but also the number one thing, like on day one in physical therapy school, they taught us you don't fix anybody. You are teaching people to take care of and fix themselves. When people finish their physical therapy with me and they're like, thank you so much, for fixing me. I'm always like, I didn't fix you. I was just the Sherpa that led you there. Or actually, my husband is also a physical therapist. His thing that he says is, I am just the lantern that lights the path, but you alone must walk it.
I
And
love
so that's
that.
very much what I feel my role is just having all of these tools in my arsenal to help people help themselves.
And that's very similar with coaching as well,
Mm-hmm.
because that is our point, is to give people the information that they need to get them
Mm-hmm.
to where they want to be.
Mm-hmm. Which is, I
Um,
think, why we work so well hand in hand because, and oh man, when I was a student, just in my head on repeat was you can lead a horse to water, but you can't make it drink. You can lead a horse to water, you can lead a horse to water. And so if I feel like maybe I'm hitting that resistance, that's where we could come in as a team and you could be helping that person work through that resistance so they can get the most out of what I'm trying to help them with.
and that is right on point. Right on point. Yeah, it took me a long time in my life as a whole to realize that me as a person couldn't fix another person. I tried throughout my life with different people. I tried with, my father who was an alcoholic. I thought I could fix him and get him to quit drinking. Um, I thought once I had a baby, the baby would get him to quit drinking. Um, my ex-husband and I always thought I could fix him because I kept trying to adjust like his diet to help with the inflammation, to get him off of, he was taking like, I want to say 2,400 milligrams of ibuprofen every day for 8 years.
Wow.
And if he would miss some or not take it or try not to, the inflammation was there. It was real. It was physical. You could see it. You could feel it.
Mm-hmm.
Um, but I was trying, other modalities, as stretching and controlling his diet and movement and all those things. Again, in the back of my head, thinking I could fix him. Um, and it's just you learn throughout life. You can't fix someone. You can't make them change. They have to want the change. They have to fight for the change and all those good things. Um, but I like how both you and your husband explain it. I feel, very similar in that I'm more of a lighthouse
Mm-hmm.
guiding people like a ship
Mm-hmm.
to those changes, to avoid the
Love that.
rocks, to, uh, you know, to provide a safe space. for people to come to the life that they want. So
Love
thank
that.
you. How do you tailor your treatment approach to meet the unique needs of each patient, considering factors such as age, lifestyle, or other specific conditions?
So I actually have a question on my intake form for new patients that says, how likely are you to comply with a home exercise program? And the options are, I love exercise, load me up, or I can handle, 3 to 5 daily exercises, or 2 exercises tops. That's it. Give me 2 exercises tops, or not happening. Absolutely not. And no matter what someone answers, I want to know the genuine, honest response to that question, because I will tailor it to the answer that is given. If the answer is absolutely not, I'm not doing exercises, I might focus more on, okay, well, this isn't like an exercise in the traditional sense. This is a self-management technique. You feel this symptom, you're going to do this self-treatment strategy. And it might secretly be something that's kind of like a stretch or seems kind of similar, but it's really meant to, relieve your symptoms in that moment. And I'll focus more on that side. Same with, I'll save that till the end, but of my other question, or the other question, but the habit stacking is the other biggest thing for people when it comes to trying to introduce new things for them. On behalf, you're going to do this exercise before every meal. You got to earn your meal. You're going to do, even if it's 10 squats before you sit down at that table and eat your meal. So you tie it to something you're already doing. Or a big one is bending mechanics. Every time you bend to wash your face, bend to brush your teeth, bend to unload and load the dishwasher, that's when you should be practicing those things. So I try to, which also then helps with the reason why you're doing these things at all. So I tie it to the real world application it's going to have for people, whatever they're doing. If it's someone who, isn't that active, we're going to be, you're going to be taking the dishes out one at a time, and you're going to be practicing your bending every time. If it's someone who's running marathons, we're going to, be doing maybe more classic exercise things and totally different for that person.
And that's perfect. And it makes a lot of sense. I like if you're somebody home, you're more sedate, you're not working, let's focus on how you do things. And I love habit stacking. I'm all about the habits. What are some self-care practices and or exercises that individuals can incorporate into their daily routines to maintain optimal joint health and prevent injury?
So 2 things you're already doing, which is breathing and walking. But the key is doing them mindfully. What muscles are you specifically using to achieve those things? Are you breathing more into your chest? Are you breathing more into your belly? Is there one side of your back that's not expanding when you breathe? And noticing those asymmetries in yourself. Same thing with walking. What muscles are you using to walk? And that's where I use a lot of props and things to kind of increase the resistance so people can better feel what they're using, because walking is actually the thing humans are designed to do most efficiently. So it doesn't really feel, it shouldn't, well, for a lot in the healthy state, it's almost hard to feel what muscles you're using to walk because it's so easy and efficient to do. But noticing, like, are you using more your thigh muscles? Are you using the glutes in the back at all? What part of your foot hits the ground when you walk? Is it different on each foot? What part of your foot hits the ground? So really, really mindful, because also the more you can notice those asymmetries and bring those to your care provider, that's also like a leaping off place to start from. And then you start to be more mindful. If you do get to the healthy state, but something starts to go off track again, you'll be more in tune to notice that before it gets to the chronic and the pain end of things. You'll notice, oh, I'm sliding back to my old habits. I can nip that in the bud. So just breathing, walking, but really, really mindful about how you're doing those things, what parts of your body are moving and executing that.
I remember when I was really into my yoga practice, like that is what helped me be so mindful of every muscle in my body and how I used it on a daily basis. And some of it was goal driven. Like I had always had fairly weak ankles as a kid. I've always had a lot of leg problems. And so when I started doing yoga, that was my whole purpose, was to improve my ankle strength. And
Love
it
that.
did exactly that, but it improved everything else.
Only happy
Um,
side effects with physical therapy and movement.
Absolutely. So yeah, thank you for covering the importance of mindfulness
For sure.
practices with those things.
I'll
Um,
give you one study to back it up from Hilton and colleagues in 2016 did prove that mindfulness-based strategies can actually even be more effective than manual therapy. So I don't exclusively do manual therapy, but it can be that tool that helps people to start moving more or to start being more. It gets them, a little bit of pain down at the start just so they can focus on the other things that need to be done. But yeah, mindfulness can uh, even immediately lower your back pain just from mindful breathing. It's possible.
and I know that as well from meditation,
Mm-hmm.
just focusing on keeping your core and sitting up straight. And then I get so deep in meditation where I'm practicing gratitude for my body that is doing what it was designed to do, which was hold me in place.
Mm-hmm.
And I can not focus on, oh, I may fall over, or, I'm not sitting up straight, or, I can focus on what I'm there to focus on, knowing that my body is doing exactly what it's supposed to do for me.
Love that.
And so, yeah, that's all wonderful stuff. I want to switch over a little bit to your women's health stuff because I want to cover that for our
Mm-hmm.
listeners. As a women's health therapist, what are some of the pelvic health issues you commonly encounter, and how can physical therapy help in addressing them?
Yeah. So sadly, women's health therapy isn't an area of physical therapy that people are very familiar with. But common conditions I treat are incontinence, so leaking, like with coughing, sneezing, laughing, or leaking if your bladder's gets a bit too full, or people who have to pee all the time, like every hour, or I've even had every half hour. People who get really intense urge if they have to go all of a sudden out of nowhere and they feel like they might not be able to hold it. And then, or people on the other end who it can take a long day, they feel like they have to go, but they sit down and it takes forever for anything to happen. Or they feel like something happens, but they can't completely empty. So those are on the bladder side. Also help with things like pain with intercourse. One of my favorite things to help with, or pain with any kind of in the vaginal area, even on the outside, or pain with tampons or even anything like that. And then pelvic organ prolapse. So it can happen to people even without a history of having given birth. But it's when your organs don't quite sit as intended. They start to slide down through that vaginal canal or even the other way. But I deal with primarily things through the vaginal canal.
Okay, so do you deal with people who have had the surgery or the mesh to kind of correct that,
Yes,
and help them build the muscle, I guess, muscle strength around that area, or I don't know.
100%. Because that mesh is an artificial solution. You haven't addressed the underlying issue of why that started in the first place. And your core and your trunk actually works as a full kind of balloon or soda can is the other analogy. And if that pelvic floor at the bottom isn't functioning optimally, but you've kind of masked it with this mesh surgery, which can be really helpful and effective for symptom management. The rest of your core, though, still isn't working optimally if you've got one of those muscles kind of offline, not functioning effectively. So the treatment might not be so focused on symptom management if the sling or mesh surgery has helped with that, but focusing on what your overall function during the day. Do you still have issues if you cough? Some people even get back pain when they cough, which is a sign of core dysfunction. So working more on building up the core as a whole. And so the pelvic floor in of itself, retraining that, and then plugging it back into the core system to work as a unit.
I'm going to pause you real quick. Oh, there we go. You had froze, but now you're back on. I could hear you perfectly, so we're
Oh, good.
we're
Good.
good. Thank you for explaining that. I know that I have a friend that went through the surgery, the mesh
Mhm.
implant, and I think she had problems maybe a few years later.
Mhm.
I don't really remember. It's been a really long time. Can you explain the importance of pre and postpartum care for women and how you experience your expertise in pelvic floor rehabilitation plays a role in supporting them?
Oh, yes. So nowadays, women have to go looking for education because back in the day, when we were a bit more of a collectivist society, you would have gone to your aunt's birth, the woman down the street. The women would have come together as a community to help this woman give birth, and you would have learned a lot through that. So that when it came time for you to give birth, you might have already attended 3 other births and kind of knew what was up, knew what to expect, and kind of some of the postpartum things. But that's not how it is now. Everyone's kind of in the dark on their own, and you have to go actively looking for information. So there's a lot of you don't know what you don't know when it comes to being pregnant and postpartum. So, and there's a lot of, you kind of expect pregnancy is going to be uncomfortable, but it shouldn't be painful. And where is that line and when to seek treatment? Because yeah, if something's actively painful, it's actively limiting your mobility, you can't walk more than 2 minutes because of a symptom, that's not normal. That needs to be addressed. But if you're a bit uncomfortable and you have to, shift in your chair a few times, that can be normal. So even just knowing the difference between those two can take a lot of education. And then I also offer about starting 36 weeks would be the earliest, but a kind of birth and delivery prep, making sure that your hips, your pelvis, everything's as mobile as possible to reduce the resistance in the birth canal. Because some people who have that prolonged labor, they're not progressing in their labor. It can be actually because of those physical restrictions in the birth canal. The baby actually can't make it through that resistance. And so that can be really helpful. Anecdotally, no promises, but some of my ladies have had only like 4 hours of labor after working on their mobility. So that's definitely something really helpful on the pregnancy side. And then the other thing is, in my last couple of sessions before they're due, I just download as much of the postpartum knowledge that I can to them in those first couple weeks after giving birth, because when you're pregnant, hopefully, the focus is on you. But the second that baby comes, all the focus is on the baby. When's the baby's next follow-up? When are the baby's shots? How's the baby doing? And no, the woman just went through this major physical trauma that no one's, you get one follow-up and that's it. Whereas your baby's got like at least 8.
Mm-hmm.
So it's actually the standard in France that everyone is referred to women's health physical therapy after giving birth, regardless of whether you have symptoms or not, just in case, just so that nothing's missed. And again, and a lot of things postpartum, people mistake common and normal. So it's very common to leak after giving birth. It's very common to have your abs separated. It's very common actually even to have pain with intercourse, but none of those things are normal and all of those things are treatable.
Oh, man, that is wonderful information. Do you have like a specific, like a program or a gift certificate that someone could purchase to give to an expecting mom so that they come to you for that information? Because, as a woman, I think some of our reluctancy is that we don't feel like we deserve the care that we need. Again, it kind of goes back to, other relatives that are like, oh, that's normal. Oh, you just have gas, or, things like that that make you question yourself, or, not feel the need to reach out to somebody and ask questions because everybody around you is making you feel that way. And definitely, postpartum depression, I think there's so much that could be caught if we had a healthcare system where women would get that kind of care for at least the first year after birth.
Mm-hmm.
Again, shame and judgment, or, women are afraid to talk about it. They don't tell anyone that they're suffering. So, I think your services are absolutely valuable. And I think would be something that would be kind of a cool gift, for an expectant mom, because that,
Mm-hmm.
what was the book? Everything you need to know about, having a baby That's it. There's that one book. I mean, that's the only book I had for the birth of both of my children. I'm sure there's more now, and there's the world of the internet, but
Mhm.
um, I think there needs to just be more education, more
Mhm.
services, and that's why, part of why I'm doing this podcast is to make sure that people are aware of these services, not only
Yeah.
for themselves, but somebody they know.
I love that idea of the gift card. I do have gift cards, so I can put a easier way to access those on my website. That's a great idea. But honestly, even I had a woman come in and it was her second pregnancy. And she said that, and I was like, so what brings you to physical therapy? Obviously you're pregnant, but anything specific? And she said, I want to do this one right. And the first time, honestly, she's like, honestly, and she was almost like whispering. She's like, they said to push. And I don't know what that means. I honestly don't know what that means. And I am convinced that she's not alone. It's so commonplace. You hear about it in TV shows and all these things, push, but how do you actually, like, what muscles you're trying to access? What is it supposed to feel like to actually do that effectively and feel confident that you're doing that effectively? So even something like that you might think is common knowledge, but actually truly isn't.
Hmm. And Lamaze, barely covers that.
Mm-hmm.
It's more, it's definitely delivery, but yeah, I don't think there's enough information out there. Uh, and because I was so young, I got pregnant with my daughter my senior year of high school. And luckily, here in Albuquerque, there is a school for pregnant and young mothers.
Oh,
Um,
amazing. Can you
and
share the name of it? Since I'm new to Albuquerque, I haven't heard of this.
I'd have to, it used to be called New Futures. I'm not sure if it's still the
Okay.
same. We are talking 35 years ago. um, but for me, because I was pregnant in high school, my principal of the school asked me to strongly consider transferring for my safety and the safety of my baby. The classes I was taking were at a separate annex that was up a dirt hill in the winter, and they were like, we can't risk you
Oh, wow.
falling. We can't risk you falling in the hallway. Just they did it for the right reasons. I wasn't being pushed out, but I was kindly asked to leave. Um, and it was for my safety. And so I got to go to this school. And what was wonderful about the whole experience wasn't just that I got education that I wouldn't have received in a regular high school
Mhm.
about what to expect with my baby and the pregnancy and delivery and all of that, but I also got to be with other girls my own age that were all going through it together. We got to have that support, not only up until we gave birth, but after. And then our kids got to grow up together, and we got to exchange, you know, children's horror stories like, oh, my son stuck peanut butter in the VCR. And I'm like, oh, my son didn't do that. But, I think that it's so important for us to be proactive in our education.
100%.
I think it's the best thing we can do for ourselves. Um, I think I'm kind of down to the last question I wanted to ask you is, what advice would you give to an aspiring physical therapist who's passionate about making a positive impact on their patients?
Sure. Well, first thing, just to get out of the way, the monetary side of it, it really does not matter what school you go to. No one cares about the name of the school you went to. It's about the kind of training you're going to get on your practicals. So looking at actually what hospitals, what clinics the school is affiliated with that you might go on your practical rotations with, that's where the real learning happens. That's where the value is. So you don't need to get into massive debt going to a prestigious school to get the degree, because you can get, slightly better quality of education, but it really comes down to where you're going to be doing those clinical rotations. And that's the experience that you're actually going to be putting on your resume when you go out to get a job. But the other thing that they really emphasize is, you can teach someone to be a physical therapist, you can teach the knowledge, you can teach the skills, but you cannot teach someone how to build rapport. That's really hard. I don't know, maybe Leanne can, maybe she can help me with that, but that's the hard thing. And listening, because the number one thing, my old job, we would get really complex patients. It would have been, I was often like the fifth clinician they'd been to see everyone. And the common thread was these people felt like they weren't listened to. So if you can really listen, and it's hard when you're a student because you got all these like measures and information rattling in your head. You don't want to miss any measures or anything like that, but really listening to the person, parroting back what they're saying so they know you're listening, addressing the actual concern they're giving you, because sometimes what you think is their main concern and what you think is a kind of scary physical presentation, that might not actually be their biggest worry. So if you can just listen to people and respond to what they're saying, will set you miles apart. And that's the biggest skill to work on. And the other stuff in PT will come.
Those are both great, especially the being present. And that is hard for me, even for me as a coach, because I'm more conversational. And so it's taking practice to be present in the moment, to really listen, to give that person space, to make them feel seen and heard. Another thing that kind of chimed in while you were talking about this, and this comes from another lady that I interviewed with a lot of medical issues, who had had a lifetime of seeking, different doctors and getting just transferred and transferred and transferred and transferred, and never really receiving a diagnosis because her issues were so rare. And the one thing she talked about was being prepared as the patient. And so she had like a 1-page list of, this is why I'm here to see you. This is who I've seen or who I am currently seeing for other issues. Just so that, one, it gets put in your medical record, but it also gives the doctor the opportunity to see you as a whole and not a 15-minute visit. Like, okay, this person has already done this, has already had this test, has this result, but still has these issues. And they're here specifically for me to treat this. But now I know that they're treating for other things. And it's not just like when you look at a medical record and it has your history, but the focus of your history may not even be, it may be 10 years ago, 15 years ago, 20 years ago, but at the top of your history list, it's still there. And so I think, being prepared as a patient can also help us be proactive in our care.
Definitely. And it is hard. I have helped patients with kind of their script, especially parents, that need to advocate for their children, or people going in for a surgical consult. They don't really want the surgery, but they just want to know what options are out there, coaching them on how to present their history, because I know the format of the notes that the doctors are going to take and what they're going to prioritize and how they should prioritize. The patient should prioritize what they want to say in a way that it's going to come across to the doctor. So there's definitely some coaching to be done for that. Unfortunately, that's just the kind of the system that we're in. But I actually love it when someone's come in, they're like, I've done this, and nothing's worked. I'm like, well, a ton of the work's been done for me. We have a huge process of elimination because not everything works for everybody. So if someone's already done the work, say this doesn't work, perfect. We're going to start here then. And then go down this path. And if there is an indication to circle back, we might, but otherwise perfect. We already eliminated those things. Let's keep going down the line. To the note of diagnoses, there is actually a really big debate in the kind of medical sphere about how important diagnoses are. The two sides of the debate is, one, having a firm diagnosis can give someone that kind of closure that this is what's wrong with me, and this is what we're going to work on. The other side of the debate is that people can perseverate on those diagnoses. They can sometimes even becomes part of their personality, their identity. That can become a big issue in healing from that. And then, when you don't have a diagnosis, then you just feel like you're flailing. And then also a diagnosis could be actually not holistic enough to capture what's actually going on with that person if you just isolate to one diagnosis. So for me, if someone really wants me to name what's going on with them, I'll give them a name, but often it's actually like movement dysfunction. It'll be like, oh, like my shoulder hurts. And I will have explained to someone like this isn't moving, and this is why this is happening. And then ultimately you're experiencing pain because of this. And I explain the whole way I use my skeleton. And they're like, well, what's wrong with me? I'm like, scapular dyskinesis. Is that a fancy word that you want? But often it's a movement dysfunction. And so I'm tracing that line back. Hey, this isn't moving. Why? Oh, because this is impairing its movement. Okay, why is this impairing the movement of this? And you just keep tracing that thread back. Maybe you end up with a name for that diagnosis, but I can still, help someone get better without a definitive name of a diagnosis.
Thank you for talking about all of that, because I think a lot of people do get hyper focused on a diagnosis, and it does become their identity. Again, I witnessed that with my ex-husband. It truly was his identity. And the other problem that created with him was my doctor wouldn't give me these medications if I didn't need them.
Ooh, I
Would
recommend
you like to
reading
touch on that one?
Empire of Pain to anyone who's in that thought process, and that'll change your mind real quick.
And what was that? Is that a book?
It's a book. It's a book called Empire of Pain, looking into the Sackler family and the opioid, and just basically what triggered the opioid epidemic that we're in, how we even got there, how that got through any kind of ethics, which there were no ethics. Spoiler alert. But yeah, that's where information comes in. If you're informed, you can allow yourself to be more trusting of people because you're yourself well informed. But if you don't have all the information and someone's simply telling you things without giving you that education piece, that's where then sometimes it's right to be a bit skeptical and go seeking more knowledge, to know that what you're being given is your best option.
Yeah, I think giving people autonomy to say that, to give themselves permission to seek other alternatives or to seek more information, and not just feel like we only have to accept what our doctors are telling us. Again, that's why I'm putting together this, community. My positive impact community is to help give people alternative information, either based on my personal experience. Like, I tend to refer out hypnotherapy because it has made such a dramatic improvement in my life for dealing with trauma triggers. Referring people to a sound healer to help calm their anxiety. I think if we're open to experiencing other things, or now I think people are being more open because science is changing. Science is recognizing more of the holistic modalities. So I'm trying to, just create a way to provide this information to as many people as possible based on my experience, people that I know, people who have changed my life, people who have improved my life. So I appreciate all of that.
I also just want to say one more thing is doctors definitely still do have their place. You get, I have a friend who got E. coli. Go to the doctor. That is a doctor handled thing. They definitely have their place, but knowing that not everything nowadays has to go through the primary care physician. That's actually an old model. Physical therapy actually has direct access. You can go directly to a physical therapist without a referral. There's some exceptions if you're, on Medicare, but you don't necessarily have to go to the doctor for every single thing. There's hypnotherapy. There's so many other places that you can present to yourself without a referral. But then knowing, and also knowing where the doctor has their place. When should you present to the doctor? Because there's definite times like E. coli that you should be doing that.
Absolutely. Yeah. I'm not saying don't go to your primary care. I'm just saying that there are other things that you can add to your toolbox. Exactly. And that's how I function in life, is all of the things in my toolbox are the things that are going to benefit me, and the things that I have learned over time that are not serving my purpose, that are not benefiting me, that are not positive, they're out. They're out the toolbox. And I found ways to build that toolbox for me that work for me. And yeah, I know I have to go to the doctor. I have to have certain tests. I have to do the, you know, the annual things that women have to do, but I don't just have to accept the outcome of that appointment.
Yes, love that. Yes.
So tell us where people can find you. And yeah, tell us where people can find you.
So I've got a website. It's ascensionphysio.com. I've got 3 free ebooks on there. There's evidence actually that effective education can immediately improve your lower back pain. So I've got a back pain ebook on there. If anyone has any suggestions or votes for what they want the next ebook to be, I'm open. But my website has all the information on there. And I also have online bookings for telehealth and in-person visits. I'm also on Instagram, also at Ascension Physio, and same with Facebook.
Wonderful. I will include your email address, phone number, everything on that I can access on the show notes for you so that people can have many ways to get a hold of you. It has been an absolute pleasure speaking with you. You have provided a tremendous amount of value and information. So I hope a lot of people listen to this episode and seek you out to help them get past these things in life or to have a better understanding. I really liked listening to how you describe working with your patients to help them identify the root cause and also providing them tips and tricks of things they can do for themselves. Of course, that's the whole purpose, but provided in a way that they're receiving all the education behind it. So
Thank
thank you
you. That was a
so
great
much,
summary.
Julia. If you enjoyed this interview, make sure you subscribe to my YouTube channel, Finding Resilience with Leanne. Happiness on Tap podcast is available on YouTube, Spotify, Amazon Music, and Audible. For more information about me, please check out my website at Finding Resilience with Leanne. And make sure you subscribe so that you'll get notifications of upcoming podcast guests, blogs, special announcements, or any promotions that I'm offering. And you can also find me out on all the socials. So thank you again so much, Julia. I appreciate your time and your value and your glowing personality.
Thank you so much for having me. I'm so thankful to be part of your community.
We're happy to have you for sure. So thank you. Have a wonderful afternoon.
Bye.
Bye.